Let's talk about healthy and beautiful aging. I'm Dr. Alana Bohslavitz, and I've dedicated my life to the study of longevity and biohacking. Today, I'm going to show you how I work and what kind of result you will achieve with a therapeutic microadipose cell processing system MAPS kit.
The MAPS kit offers a new approach to small volume fat grafting, allowing physicians like myself to harvest, filter, and transfer up to 50 cc of adipose tissue in 3 different types of tissue grafts, all in under a couple of hours. Our patient today is Trista. She's the perfect candidate for this procedure because at 47 years old, she has never had any facial treatments. No fillers, nothing. Why did Trista come to me now? During our consultation, she expressed concerns about her appearance and shared pictures from the past when she felt more confident. I noticed some volume loss in specific areas, which is what we'll address today. For Trista, I'll be working on just one side of her belly because she had liposuction on her abdomen years ago, which caused some unevenness that I'll be correcting. But normally, I work on both sides of the lower belly to ensure even results after the procedure, as it provides the best quality fat. So, where do we start? First, I mark the area and apply topical anesthesia to her face, which needs to stay on for about 30 minutes. That's just enough time for me to prepare the fat for injection so that her face will be numb by the time we begin. Here's an important detail. Before moving forward, I make sure the rest of her body is covered with a sterile sheet, leaving only the area we're working on exposed, and I am also wearing a sterile gown and sterile gloves.
Next, I disinfect the area on the abdomen where I will harvest the fat
using chlorhexidine followed by betadine. And take note, I've already set up a sterile workspace in advance. After disinfecting, I mark the area again with a sterile pen and inject a small amount of lidocaine at the entry point for the cannula.
I've also prepared the Klein solution, which is used for fat harvesting process.
The Klein solution starts with 1 liter of normal saline as the base. To this, I add 50 milliliters of 2% lidocaine to minimize pain, 1 milliliter of epinephrine to reduce bleeding by constricting blood vessels, and 10 milliliters of sodium bicarbonate to buffer the solution, reducing the acidity of lidocaine and making it less painful upon injection. Once all the components are mixed,
I gently mix the solution to ensure everything is evenly distributed.
Now, I insert an infiltration cannula 20 millimeters in diameter and 15 centimeters long. Gently pressing the plunger to retrograde, fill the area with the Klein solution. I'm planning to harvest around 50 to 60 cc of fat, which means I'll inject 2 to 3 times that amount of Klein solution. I wait about 10 to 15 minutes for the solution to take effect before starting the fat harvesting process.
For harvesting, I use a 15 centimeters cannula
with a unique 1.2 millimeter aperture and a 20-hole 4-sided array. I lock the cannula in place and carefully harvest the fat, making sure not to damage the surrounding tissue. The fat is collected in 20 cc syringes, and gravity helps to separate the fat from any remaining fluid. As you can see, there's a small amount of blood in the syringe, but it's minimal. I'll clean it up to ensure we have pure fat. The first step is to attach a filter to the bottom luer lock on the syringe and ensure it's securely fastened. Then, I push the fat through the filter into a waste container, stopping once I feel resistance to avoid losing any fat during the process. Next, I wash the fat with saline, which I've already pre-filled in syringes. This makes the transfer process much easier. I inject the saline into the syringe with the fat, mix it gently, and let gravity separate it again. Once ready, I use a micronizer to further refine the fat. I attach one side of the syringe filled with fat to the micronizer and the other side to an empty syringe, passing the fat back and forth 5 times to break it down to 500 micrometer sized particles. If I wanted even finer particles, I could repeat the process a few more times, but in this case, 5 times is enough to maintain the fat cell's integrity for optimal rejuvenation results. This microfat can now easily pass through a 21 gauge cannula, which is what I'll use for the injections today.
Now I have the microfat ready to inject into the face.
I'll carefully assess Trista's face again to identify the areas that need the most volume and begin the injections there. Before I proceed with the microfat injection, I administer a small amount of 2% lidocaine at the cannula entry point to ensure maximum comfort. I'm targeting all the key facial compartments and supporting ligaments, including the central and middle forehead fat, lateral temporal cheek fat, superior and lateral orbital fat, infraorbital fat, superficial and middle cheek fat, nasolabial fat, as well as the superior and inferior jowl fat and premental fat. I'm sure you're wondering, how do patients feel during the procedures? If you follow all the instructions, the procedure will be no more uncomfortable for your client than administering dermal fillers, but with significantly more benefits. By precisely targeting specific facial compartments and ligaments, I achieve a natural volumizing effect that enhances the facial contours, resulting in a refreshed and youthful appearance. In addition to restoring volume, this procedure significantly improves skin texture and tone, promoting complete tissue regeneration. It is an excellent option not only for patients experiencing volume loss, but also for younger individuals seeking to rejuvenate and enhance their skin for a healthier, more radiant complexion.
Thank you for watching, and I hope you found this demonstration helpful. If you have any questions or would you like more information, feel free to find me on social media under the name of Dr. Bohuslavets. I'm always open to collaborations and mentorship. A healthy approach to aging is so important.